What do America's patients want out of healthcare? Ask Gary Gruntz, who suffers from a number of chronic conditions. Like many patients, he wants a doctor who understands him and looks out for the full range of his medical needs. Here's Gary's wife, Fran Gruntz.
Recently, Gary was diagnosed with the atrial fibrillation, which would then cause him to go into congestive heart failure. He couldn't walk more than a few feet. He just could not do much of anything. Eating and sleeping were probably all he was able to do.
So I'm seeing Gary for the last 15 years as a patient. And in the beginning, he had the problem with the hypothyroidism, COPD, and atrial fibrillation. But then he translated into getting diagnosis of multiple myeloma and amyloidosis.
Patients like Gary want a care team in which nurses and others work together to plan and coordinate their total care. That means not just addressing their medical needs, but their social needs as well.
Each day I talk to Fran and Gary and I get an assessment of his mental health and his physical health. Through listening, I was able to decipher what they needed, and I was able to devise a plan with them, not for them, but with them. We set daily goals of exercising on the treadmill and eating a heart-healthy diet. Our weekly objectives were able to give him more responsibilities around the house. Now he is assisting with daily chores, babysitting for his grandchildren.
Because of the care that I'm receiving, I feel better than I have in years.
Value-based care like this has not only helped Gary, but it's also helped people like Bernice. She's a recovering cancer patient, and like Gary, needs a team looking out for her total well-being.
We focus so much on preventive medicine. So we have social workers, we have physical therapy, we have home care dimensions that goes to the house and does sleep studies. And these things make it easier for our patients to take care of their other needs.
Doctors and their care teams, delivering what patients need and improving their health and well-being. That's the value in value-based healthcare.